Let's unpack it all, how it will all unfold at those various sites of vaccination. Let's go live now to our reporters. Aisha Ismail is in Khayelitsha. We have Manqoba Mchunu, who is at the Steve Biko Academic Hospital, as well as Heidi Jokos outside Chris Hani Baragwanath Hospital in Soweto. Let me start with you, Aisha, because that's really the main hive of activity this afternoon. The details and the logistics of how media will be able to capture that moment when South Africa enters the battlefield in as far as vaccination is concerned. Those have been communicated. What's the situation there in the build-up to the start of the vaccination processes, and what do we know about how it will all unfold?
Good afternoon, Thulasizwe. So we're here at the Khayelitsha District Hospital. There's lots of excitement and activity here at the moment, preparing for the President to arrive, as well as the National Minister of Health and his deputy. And as you said earlier, that the media were not allowed to witness this historic event of the arrival of the Johnson & Johnson vaccines arriving in Johannesburg last night. Well, we've now been granted access to actually witness the first vaccinations that will take place in South Africa, which will take place right here at the Khayelitsha District Hospital. But you're asking me to unpack and to tell you how the day will unfold. I'm now joined by the MEC for Health in the Western Cape, Noma French Mbombo. MEC, I want to ask you, are you going to be vaccinated today?
Not me, because I don't fit in regard to the categories. For the Western Cape, we took a decision on the equitable access because among the healthcare workers, you still have got those who are more highly risk in terms of the exposure, and also in regard to the individual vulnerability, and therefore I cannot jump the queue. But it is also crucial that this is a minimal of the doses that we are receiving now out of the 80,000. The last time I checked, for us, we are going to be allocated 13,000, which will be divided according to the two sites that have been mentioned. So with that 13,000 that we are getting vis-a-vis the 133,000 that we were initially expecting according to the phase one, how do I jump the queue at the expense of all other healthcare workers? Because as long that they are not safe, I'm also not safe. Take also into consideration for this phase, the rural healthcare workers are not included. But what we have done is to ensure that at least there is a variety of the other healthcare workers. The EMS, as you can see, I'm wearing the EMS jacket here, the community health workers, nurses and the doctors, and also not only the tiger bag and the Grooteskier staff, but also the feeder areas from the primary health care and all of those. So we have to consider that.
So who will be the first person to get the vaccination today?
Healthcare worker. We do have a nurse, we have got the doctor, we have got also a community health worker, also got another category, because these vaccines, especially that South Africa has been given the emergency approval specifically for the implementation in order not to wait for longer for the health workers to be able to get the vaccine. So they will be the ones that will be getting the first vaccine. As you correctly indicated, that we are waiting for the President, the Deputy Health Minister and the Health Minister, which I don't have a confirmation for now whether they'll be vaccinated or not, but let's give them an opportunity they can explain themselves.
And just before I let you go, there's been a lot of controversy around the AstraZeneca and now Johnson & Johnson. Are you confident that we've made the right decision now?
Based on the available evidence, for a vaccine that could be able to save lives in regard to the prevention of the severe illnesses and also the deaths within the variant 501YV2, that one is definitely the right choice. Of course, there are other candidates that are being explored, like the Pfizer and all of those. And also at this stage, I don't know what they're going to do with the AstraZeneca. But Until that time that we know what is the evidence, especially in the context of this variant, then that's when we'll be able at least to participate in that. But noting that for this approval is part of the clinical research for the implementation and rollout of the vaccines. In 12 weeks' time, according to the National Health Minister, there are about 9 to 12 million doses that they'll be expecting from the J&J to expand further to other, not only healthcare workers, but also to the phase 2 other categories.
Thank you so much for your time. And that was the NEC for Health in the Western Cape, Noma French and Bombo.